Well, thank you so much, Laura. Good morning to everybody, to all the friends in different cities. It's great, and I'm best luck. Let me share our experience, Bogotá Care Blocks, how a city can be reorganize itself for women and to the achievement of SDGs. So let's go first to how is Bogotá? Bogotá is a big city, it's the capital of Colombia in Latin America. We are a city of 8 million people. We are divided in 20 districts. 52% of our population are women. Our income per capita is roughly $12,000. And mayors were first appointed until the end of 1980s. And since 1988, mayors are elected by popular vote in Colombia. I have the honor to be the first woman to ever be elected mayor of Bogotá. So that's our city. Now, let's see what was the problem that we look at, that we faced. Out of the more than 4 million women in Bogotá, at least 1.2 million of them are caregivers. They devoted their lives to unpaid domestic and care work. They work more, 7 hours per day, but they are not paid at all and not even helped. They have sacrificed their lives for taking care of others. And this result in that out of these 1.2 million women, at least 20% of them have chronic illness. A third of them have no time for care for themselves. At least 70% of them have not even finished high school. And because of that, they are at least more than half of them under poverty and the problem of income, lack of opportunities. So they face time and economic poverty because of this overburden. I'm the mayor. I have some social functions and infrastructures. So the solution that we designed to help caregivers, 90% of them are women, was to organize care blocks in Bogotá. Care blocks are the commitment, the use of different social infrastructures, schools, recreation facilities, cultural centers, health centers, to provide three types of services. First, of course, time and services for women, to provide them the opportunity to rest, to finish school, to get labor opportunities, to generate income, to have well-being for themselves. Second type of service, that's possible because we, the Mayor Office of Bogotá, and our professional people, take care simultaneously in the same facilities of the people that these women were taking care of, mainly children, elders, and members of their families with disabilities. And the third service is a cultural transformation service. This overburden upon women is because of cultural tradition of machismo or patriarchalism. So this cultural transformation for other members of their families, particularly men, is very important, is the third type of service. Why this change for serving caregivers was triggered? Well, first of all, Bogotá has the enormous advantage of have a very strong social movement, women's movement, feminist movement. I signed with them a pact when I was a candidate to include this care, feminist, urban approach to our social services. Second of all, as I mentioned before, I'm the first woman to be elected. I have a mandate in life, not only in political service, to do something for the most vulnerable women in our society. Third of all, the pandemic. It increased this overburden on women. So we need to come up with this practical solution. As you could see, this is sort of the way we organize different social infrastructures that are 15 minutes away from each other. And we add services directly designed to recognize, redistribute, and reduce this overburden of domestic and unpaid care work for women. Bringing these services in simultaneity. At the same time, we provided three types of services in the same facilities, being flexible in the schedules, in ways of provision, in types of provision, and at the same time, making all the mayor's office and different entities to work together, not in silos, but really in a systemic way. So as you could see in this slide, we have, for example, free laundry services. So that woman had not to wash and wear the entire clothes of their family by hand, but in a machine that is a free service. At the same time, this woman can take opportunities to finish school, to do post-secondary school, to get a job, to start an entrepreneurship, to learn how to ride a bike, for example. And at the same time, we take care in the same space simultaneously and more flexible of the children, of the elders, of the people with disabilities and their families. And other members in their families, particularly men, come to the school to learn to care. Why this is relevant in our agenda? Why this is important for achieving the Sustainable Development Goals? I will claim that these care blocks for women and their families are able to contribute to all the SDGs, but particularly at least for 7, the one where you're looking at the slide. Because this is a social innovation that address an urban and a social challenge, which is that women that are half of the population everywhere are trapped in time and economic poverty. While they are in that situation, will be impossible to achieve the SDGs. So this is an urban challenge and a social innovation for gender inequality, for climate crisis, for quality of education, for systemic IT governance innovation too. So we went by steps since 2020 that we started. First, this started, as I mentioned before, as a women's movement proposal. Then we take that in my program. We include it in the development plan of the city. We agree with the city council to do this. And the first care block started in 2020. Then we add buses because there are rural dispersed areas also in my city. So we don't have that infrastructure. So we take the services through buses. We elected representative women or caregivers organizations within the system to help us to design and improve the services. Then in 2022, we were able to set up at least 15 care blocks, and we were able to include these care blocks and this caring vision within the land master plan urban of the city. And then in 2023, we were able to reach out a global consensus in the city so that this is no longer a government proposal, is now a city law to reach in the next 15 years at least 45 care blocks. What was the main challenge at the beginning? I will mention 3. First of all, for many women in the world, this is supposed to be normal, to be in charge of this domestic and unpaid care work. This is not normal. And making them aware that they have other rights, that we can help them achieving their rights for economic autonomy, education, labor inclusion, that was a challenge, but it was overcome through the social movement of women. Second of all, the transform of the mindsets of the public administration to not work in silos, but in a systemic governance way, working together, sharing infrastructure, sharing services, adding new services. And the third challenge was to go from this paper-based registration of different services to an IT interoperable data system, InfoCuidado, so that we know which women we're serving, which services are most useful for them, more impactful in their lives. What lessons we learned through this time? First of all, this has to reach consensus, social movements, political organizations, the private sector, and to build an awareness that we can support and we must support women to get out of time and economic poverty. What we'll do again if we start over? First of all, to innovate, not to be afraid to innovate, to maintain the focus. It's not women at all, it's caregivers, unpaid caregivers who have the most overburden of poverty in our society. Second of all, be practical and pragmatic using infrastructure that we already have. What we will
Excuse me, Mayor Lopez, just to say there's about 1 minute left.
Yes. What we'll do differently if we start over again? Maybe to concentrate in more specific services. We started with 35 different services, and at the end, we set up these 3 types of different services. To have a massive communication strategy so people know about this new service. And third of all, involve from the very beginning the private sector. We involve them later on, and maybe since the very beginning will be better. Care blocks are a replicable solution to leave no one behind, particularly women, half of the world's population. Along with youth people, we are the driving force for sustainable development, but we cannot leave them behind in unpaid overburden of care work. That's the way to build inclusive and sustainable cities. On behalf of the more than 450,000 women who have found opportunities, income opportunities, political opportunities, economic opportunities, thanks to the care blocks, we thank to you for the opportunity to share with you this social innovation for women, for their families, and for our societies.